the alarm blares. You hit snooze not out of tiredness, but because facing the day feels impossible. There's a heaviness in your chest, a dull ache that colors everything. Even simple tasks feel monumental and you can't pinpoint why. We call it stress or burnout, and we push through, hoping tomorrow will be better. But when every day feels the same, exhaustion deepens, not just in your body, but in your mind. Conversations drain you, hobbies lose their spark, and the future looks gray. This isn't just a bad day, it's a pattern that erodes your sense of self. You replay conversations, worry about the future, and feel disconnected from your own life. This is where the conversation about mental health begins, in these quiet, personal struggles. Recognizing that this exhaustion has a name and a path to healing is the first step. It's the moment you decide to turn on a light in the dark room of your mind. Understanding is the beginning of hope.
Once you name it, you can work with it, learn about it, and manage it.
You're not alone. These conditions are common, and naming them is the first step to healing.
Naming the feeling, anxiety, depression, takes away its mysterious power. It becomes a specific problem, and specific problems have solutions. The diagnosis isn't a label that defines you, it's a signpost toward recovery.
This perspective removes shame and opens the door to compassion.
Many people say, I don't know what's wrong, I just don't feel right. The first step is to give it a name. We're often talking about anxiety and depression, medical conditions, not character flaws. Imagine your brain as a smoke alarm. Anxiety is when it's too sensitive, going off at the slightest trigger. It's trying to protect you, but it's stuck on high alert. We wouldn't blame someone for faulty wiring in their house, so why blame ourselves for our brain's wiring?
To make sense of these feelings, I spoke with Dr. Anya Sharma, a psychiatrist. You can't just calm down. The brain's alarm system is stuck on. Telling someone to relax isn't helpful. It can make things worse. Recognizing anxiety as a treatable condition is the first step to managing it. You can learn to swim with the current, not be swept away.
Anxiety disorders involve excessive, persistent worry that's disproportionate to the situation. Symptoms aren't just mental. Your heart races, you sweat, you feel dizzy. Cognitively, anxiety means racing thoughts, catastrophizing, and a sense of doom. A simple unanswered text can spiral into panic. There are different types: generalized anxiety disorder, panic disorder, social anxiety.
Anxiety is the body's natural response to stress, a feeling of fear or apprehension. It's helpful in small doses, keeping us alert for challenges, but for some, anxiety becomes constant coloring every day. It's vital to distinguish sadness from depression. Sadness passes, depression lingers and disrupts life. Depression isn't a choice or a weakness. It's a medical condition that changes brain chemistry. Recognizing this distinction is essential for compassion and proper care. Depression needs treatment, not just comfort. Understanding this is the first step to healing.
Anhedonia, the inability to feel joy, is a key sign. Hobbies and friendships lose their appeal, and a sense of emptiness takes over. Guilt and worthlessness become constant companions. Depression affects sleep, appetite, and energy, causing deep fatigue and even physical pain.
Depression is more than sadness. It's a persistent, suffocating loss of interest and hope.
Genetics can increase your risk, but it's not inevitable. Brain structure and function play a role, as do trauma and chronic stress. Even ongoing pressures, work, finances, discrimination, can wear you down. Physical health and lifestyle matter too. Sleep, diet, and illness all impact mental health. Mental health is whole body health. There's no single cause, and it's never your fault.
Anxiety and depression arise from a complex mix of genetics, brain biology, life experiences, and environment.
The question why rarely has a simple answer.
If you feel worthless, guilty, or have thoughts of self-harm, seek help immediately. Difficulty functioning at work, school, or home means it's time to reach out. Recognizing these signs is an act of strength, not defeat.
Watch for persistent changes in mood and behavior. Sadness, anxiety, irritability, or withdrawal that lasts weeks. Loss of interest in things you once loved is a major red flag. Changes in sleep, appetite, or energy are also warning signs.
Knowing when to seek help can be hard, especially if you're used to pushing through. Small, intentional choices add up, building a foundation for well-being. Every step counts.
Be mindful of what you consume. Limit distressing news and social media. Set boundaries with technology, especially before bed. Fill your time with calming activities, reading, music, or journaling.
Even a minute of focused breathing can create calm.
Gentle movement, like a 10-minute walk or stretching, can lift your mood. Mindfulness and grounding techniques, like the 5-4-3-2-1 method, anchor you in the present.
Build a simple routine. Wake up, eat, and sleep at regular times.
When you're overwhelmed, focus on one small step at a time.
You don't have to do this alone. Connection is a key part of healing. Reaching out is a sign of strength.
Social connection is powerful. Reach out to friends, family, or support groups. Even a simple text or coffee can break the cycle of isolation. Support groups, in person or online, connect you with others who understand.
The decision to use medication is personal. Talk to a doctor about what's right for you.
Medication can also help, often alongside therapy, to stabilize symptoms.
Cognitive behavioral therapy. CBT is effective for anxiety and depression, helping you challenge negative thoughts.
Therapy offers a safe space to explore your feelings and learn coping skills.
Sometimes, self-help isn't enough. Reaching out for professional help is a courageous step. If you're struggling, you are not broken. You are human. These conditions are part of the human experience, not a sign of weakness. Healing isn't linear. There will be ups and downs. The goal is resilience, not constant happiness. Every small act of self-care builds strength. Share what you've learned, talk to others, break the stigma. Your story can help someone else feel less alone. Remember, you matter and your feelings are valid. Healing starts with a single step, a breath, a walk, a call for help. You are worthy of healing and you are capable of it.